Hi, it's Michelle, the Roaming Dental Hygienist, and we are talking interdental between the teeth tools. This particular one is not floss because there are other ways to clean between your teeth. I want to talk about your interdental brushes. Proxy brushes is another way. I'm going to show you the TePe brand. There are a lot of colors here because they are color coded for sizes. There's up to 9 different sizes. And the reason for that is because it is not a one size fits all game here. We want to make sure that if you are managing the medical diseases that we see between the teeth in the mouth, then we want to find the products and the tools that are right for us. I almost compare it to a prescription. If I had high blood pressure, I wouldn't just go to the pharmacy and be like, hydrochlorothiazide. That sounds like a good product for me today. I, as a dental professional, size all of my patients because those tools and the ones that fit your mouth and your body, that's going to be that works for you. So I'm going to show you how to size yourself at home. So you can get in my storefront these variety packs with all the different colors. Then that's the shorter handle, and then we also have the same version in a longer handle. They are the same color, so a red in the short handle is a red in the longer handle, okay? Now the longer handle only goes up to green, so, and the shorter guys will go purple, gray, and then there's even one larger than this guy, and that is the black one. And so you get a few more size options in the short handles like these. But I'm going to show you how you size your mouth no matter what. I like this variety pack because at least you find your size and then you order that size. And they come in multi-packs. So you'll get, 6 pinks, 6 or 20. I think you can even order 25 packs on Amazon. So there's different colors. We're going to size and we're going to find your color. Okay. So I would say start with the smallest one. That is the pink one. And your goal with it, you take the cap off, especially the short ones, it goes to the end like this. It makes a little longer handle. I do not bend any of the small guys. The wire is just too fragile, too flimsy. It will not serve you well. I'll show you when I start bending them. But this little guy is already pretty flexible here. We're going to start here, and our goal is to get it between the teeth without the wire touching the sides of the teeth. We do not want the wire touching the sides of the teeth. They are plastic coated wires, but regardless, we do not want to cause any abrasion over time of using these, kind of putting a little notch into the tooth surface. These bristles, though, we want them to fit well enough that they go in between the teeth, they fluff out, and they come back through. That's our goal. So I'm going to start with this one. And we're just going straight in. Now, some people, in their eye, they go in and then they bend backwards and they do kind of weird things like that. So my little trick for that is to get it between the teeth, find your opening, and just kind of shimmy. I don't know why it gets your brain and your hand in different realms, and it just works. So you get it in there and you shimmy. I can get this through pretty well. I can get this in there and not touch the sides of my teeth. So I'm going to try the next one, which is going to be orange. I'm going to actually try it in the longer handle so you can see the difference. And this is sometimes nice for the back teeth. Get it right there on the top. Shimmy. Go in there. So what's nice about this one is I'm starting to feel the wire just slightly, but I feel as if the bristles are filling that space just a little bit more. So this is probably where I'm going to stop. Now I do have some bigger spaces down here, and I think I could go to a red. Let's see. The red is just slightly bigger. Yeah, that actually feels really great in that area. Now, the reason I like the longer handle sometimes is because you go from the inside too. And all you're doing is going back and forth a few times. Just scrub, scrub, scrub. Very similar to the bristles of a toothbrush. Now, the larger ones that I start to bend would be kind of once you hit your yellow-green colors, sometimes bending them like this. If you do, I encourage you to keep it there. It's the back and forth that will wear out this wire. But you can see that's a large brush, and that does fit some spaces between the teeth. So if you have larger spaces, like this guy, where you can actually see the space, maybe that's a good version for you. I like bigger ones. The goal is get it between your teeth. Don't let the wire touch. You want the bristles to feel snug enough that they fluff out and go through, but you don't feel the wire touching the sides of the teeth. Patients that have braces, I love the larger green on a handle, and that would essentially go between the brackets up. So you can go this way, but I would encourage you to go more away from the gums, because sometimes when you go down in there, you'd poke, right? And we don't want that, right? So you would go from above the brackets and go straight down and kind of clean in between the brackets. And then you could use like your on-the-go option, like the TePe Easypick or the smaller pink or orange to use between the teeth when you have braces, which is just fabulous because flossing with braces is tough. Now, one quick thing about the Interdental brushes, they are not one and done. You can use these multiple times. You're gonna be like, oh, well, when do I know how to get rid of them? And that's kind of hard to say. I would say some of these smaller ones, only a few days. They're just, you know, they're not as durable. The larger ones, like your yellow, green, purple, gray, and black, maybe even 7 to 10 days, depending on what they look like. Heavy-handed people that are just like scrubbing back and forth, they wear them out a little more. People who go around metal substructures like crowns with the metal bottoms underneath them, any implants, braces, things like that, then you know you're going to wear them a little faster. I just tell people, look at them, look at it. If the bristles are no longer at this 90-degree angle and they're more like sitting like a little arrow, time to get rid of it. If it looks like a little curvy road, time to get rid of it. We want these bristles at that 90 degrees. This is a brand that I particularly like. It's a TePe one because it has the 9 sizes. You can choose yours. Some of you might be 2 sizes, and that's totally normal. I would just get the variety packs, start with the tiniest one, the pink, and then work your way up and just see how that feels. Again, make sure that wire is not touching the sides of the teeth. If you see a little bleeding, that might be because we're stimulating that tissue and disrupting that biofilm that has been irritated and inflamed. And that's just going to clean up over the next few days. So best of luck. No toothpaste required, no medicaments. Just use these little brushes. Now, if you want to, you can, but I would honestly just use it with the dry brush. Go between your teeth at least once a day, and best of luck.